Now we would study about a very important investigation that we commonly used in our glaucoma diagnosis and management, that is called optical coherence tomography. Now first of all, why we need optical coherence tomography? Remember, optical coherence tomography is a non-invasive, non-contact imaging system that uses a superluminescent diode light source to create high resolution, real time, cross sectional tomographic images of the retina. Okay, so what it means is, unlike a fluorescein angiography, OCT is a non invasive technique. It is a non contact imaging system. So, unlike gonioscopy, where we basically touch the cornea, here we do not basically come in contact with the cornea. And what it uses a diode light source. Remember, in ultrasound biomicroscopy, we use sound waves, and here we use diode light source, and what it creates is a real time cross sectional. That means that we can basically see all the layers of the retina, and this basically helps us for the diagnosis. Now, OCT per se, where we can use it in our glaucoma clinic. We can definitely use it for the diagnosis of early glaucoma, and we can also use it to see if there is any progression of glaucoma. Then this is my favorite indication, that is basically objective and quantitative assessment of glaucoma. Now what it means is that, let's say patient comes to your clinic and he says, sir, I have come here just for getting a power of glasses. I do not have any other problem. But you tell the patient, okay, you are having a glaucoma. Now how you would show it to the patient? Because patient is not convinced about this. He has come only for the glasses. So you can do an OCT, and in the OCT you can show that there are some parts of the OCT which are showing that there is some damage. So here the OCT would help us to basically convince the patient also that he is having some problem in the eye. Okay, now this is not the only technique. We can also use visual fields, we can use fundus photograph, but OCT would have a better impact, where it would also tell us that quantitative, that okay, your RNFL should have been, let's say 90, but in your case it is 70, and it is collaborating with the optic nerve defect which we are seeing in the your glaucoma. So that's why you are having glaucoma, you need to start your treatment. Now, a question that is important for your MCQ: what is the contraindication of doing a OCT? So remember, unlike a patient of visual field, which you cannot do in a patient who is non-cooperative or having severe back issues, you can do an OCT in a minute. So even elderly patients can do an OCT. But if the patient has undergone a photodynamic therapy for any retinal lesion, you should avoid it for at least 48 hours. So this is an MCQ you should remember for